how you start a session, what happens during, and then how you close for an individual session, and maybe also for a group. It doesn't have to be something so everyday, but just something that you feel that you kind of do often, and then maybe for a group, something that just stands out to you.
Sure. For individuals, first and foremost, always kind of check in with them and see how their weekend or week has been going. It's good to kind of get a feel for what we're walking into. And then we jump right into it. We jump right into the computerized exercises. So we might pick up where we left off from the last session, or we might be kind of on to the next one. But it's always kind of going, starting maybe with something that I know or they know is relatively familiar and easy. And just because we want to kind of start on a high note. And then once they got their feet underneath them, maybe a few minutes, sometimes it's a little bit longer, I begin pushing them a little bit more and going on to maybe unfamiliar stuff or just more challenging and complex tasks and activities. And then, as I alluded to earlier, usually that goes on for about 45 minutes. My sessions are always 75 minutes.
Okay.
So that goes on for about 45 minutes. And then we transition into the skills and strategies piece. So for an individual, that will be ready-made. So I'll prepare that particular session based on the goals of that client, as well as based on what the assessment, what we need to be actually addressing as far as the cognitive piece. And then, so we'll introduce those skills and strategies, and we'll do some practicing, and we'll go from there. As far as groups are concerned, that looks a little bit different. Again, the check-in's always there, just because you have to get a feel for what's going on. But with groups, it's oftentimes, unless the person, unless they are brand new, it's really independent. So we'll check in, we'll do kind of the introduction piece, and then they'll kind of get to work and picture kind of a group full of individuals, and myself or some, whoever is running the group, I'm checking in individually every few minutes with each person, or just silently standing behind somebody and kind of watching the choices that they're making and the exercises that they're playing, and maybe making recommendations. And kind of not controlling, but monitoring what's going on. And then that will also transition into the skills and strategy portion of the group. The difference between that and individualized part is that will usually be a standard session. So that'll be kind of ready-made. It'll be tailored to the interests of the clients in the group, but it's a more broad one in particular.
Gotcha. So how do people find you? How do clients get referred to you to come start this process?
Yeah. So the most common way for clients and people to find me is usually through, I mentioned earlier, the kind of the transition out of the hospital stay. So oftentimes they're kind of mixed into there with a clinician will find me or go through that process. A number of people do end up kind of searching online and find me through my website, which is rchinstitute.com or restoringcognitivehealth.com, whichever one. And a therapist also. So psychiatrists and therapists will often kind of know about cognitive remediation, know that I'm really one of the few people that do it on an outpatient basis in this area, in Southern Connecticut and the New York City metro area.
Very cool. All right. Well, Gregg, thank you so much for your time. Gregg Pauletti of the RCHI Institute. And this has been a fantastic HappyNeueron Pro talk.
Thanks, Dustin.